Hi, I'm Dr. Nick Hayward. Welcome to COVID-19 Long Haul Stories. Today it's Ali's story. Ali, tell us a little bit about yourself and especially how things were for you before COVID-19 even came along.
Oh, thank you. Before I got COVID, I was very active. I've got 2 or 3 jobs that I do. I look after a disabled son. I've got 2 whippets. I run my own business, so I was very, very active. And I was doing 2 or 3 different dance classes a week, Zumba, just different things. So I was very, very, very active. So when I actually got it, it hit me like a ton of bricks. So when I got COVID-19, it was Easter Sunday, and I'd woken up in the morning and I just didn't feel very well. I felt drained and I ached everywhere. I actually thought I was coming down with a bit of flu or something. Said to my mum, look, I don't feel very well, but I didn't really have a fever at that point. I was just feeling off. Ended up going to bed sort of about 6:30 because I was just wiped out. That was on the Easter Sunday. Couldn't do anything on the Monday, obviously, because it was bank holiday. Tuesday, I phoned the doctors and said, look, I really don't feel very well. And I said, I genuinely don't know what it is. I feel sick. I'm bloated. I just don't feel well. And she said, right, go through your symptoms with me. So I went through them all. And she said, and at that point, I couldn't get warm. I was freezing. And she said, you've got COVID. She said, I'm 99% certain you've got COVID. They're not testing. So, if you feel worse, get back in touch. So I was like, okay. So that was on the Tuesday. I phoned them on the Wednesday because I by that point I couldn't walk properly. My legs had gone. I could barely stand up. And on the Thursday I phoned and I said that I was having problems breathing. And they said, you've got pneumonia. You're on day 5. That's pneumonia. And they actually brought me the antibiotics out and said, you have to start these now, which I did. So on the Friday, my son ended up phoning 999 because I literally could not breathe. So the paramedics came out and they said, you're going to have to go in. So they took me to our local hospital. And at the time, the hospitals weren't testing. So I arrived and the hospitals didn't have PPE properly. All the nurses had on were masks and plastic aprons. It was just shocking, really. They took one look at me because my oxygen sats were okay. They went, you're already on antibiotics. Your sats are all right. You're safer at home. So they put me in a taxi and sent me home on my own. And basically, it was sink or swim. I was either going to get better or I was going to get worse. But the ambulance driver had already said to me, if they send you home and you don't feel well, he said, phone us straight away. He said, because we've been having people saying, been phoning that say they're not well. And by the time we've got to them, they've died. And he said, seriously, if you don't feel well, you phone us and we'll come straight back. So that was sort of that first week, really. And then I sort of struggled on over the next couple of weeks. It took me about 3 or 4 weeks to really get back so I could actually walk from the living room through to the kitchen without having to stop on the way. And I just didn't feel right. By that point, my breathing was really bad. And I thought it was just where I'd had the pneumonia. I had a double dose of antibiotics when they diagnosed it originally. They then had another dose when they was finished because I still wasn't right. And then I said I was still having problems breathing. So my GPs gave me a Ventolin inhaler to start off with, which helped a little bit, but not great. And then eventually gave me a steroid inhaler as well. And the steroids made a hell of a difference. So I've never smoked. I've never been asthmatic, but now I'm having to take a Ventolin inhaler and a steroid inhaler. And, that's something I never really expected to be in that position. And if I talk too long, I go hoarse. My voice will get more and more husky as the conversation goes on. And things like air fresheners will take my breath away. I went into a carpet shop the other day, and the smell of the carpet, I couldn't breathe. I had to use my dental inhaler and walk out. So I've never been like that, and that's one of the things it's left me with. So that was part one. Part two was about 5 or 6 weeks later. I woke up and I couldn't breathe. So I ended up going, having spoken to 111 and then out of hours service, I ended up going to the hospital, had every test known to man, by which point the countess actually had, they all had proper PPE on. And they looked like something out of ET. And then the chappie that came to see me, he said, underneath this, I'm gorgeous. I was like, I believe you, love, I believe you. But they did literally every test known to man. And he said at that point, he said, your breathing is bad because you have got damage to your lungs. That's what the problem is. What was weird was, you know what it's like in hospital cubicles. You can hear what's going on in the next one along. And there was a lad who came in sort of just after me, and his story was exactly the same as mine. He'd had COVID around about the same time I did at Easter, and he came in and said the same thing, that he'd woken up and literally couldn't breathe. And he was on inhalers and stuff as well. It was just odd, very, very odd. It's just one of those things. So that we struggled on then, and I assumed I wasn't feeling well because I couldn't breathe properly. I couldn't catch my breath, and I just thought, I'm worn out, because that's the other thing is fatigue. You're just absolutely knackered all the time. Your legs ache, your joints ache. It's just debilitating. It's just a horrible illness. But then, as I said, I then had the big part of it, which was I'd been out for a meal at my friend's house the first time since lockdown, had a Chinese meal, and I'm allergic to potato, and I assumed that the reason I was feeling ill was because they must have put potato starch in the food, and I was up all that night throwing up, genuinely not feeling very well. Following day was the same, and so I was throwing up from the Saturday night, and I phoned my GP, couldn't get through to actually speak to somebody. You couldn't get past the receptionist. I said, please, I need to actually see somebody. No, they'll decide whether they want to phone you back. So they were treating me for gastritis over the phone without seeing me. And then by the Thursday, I was literally curled up in a ball on the floor, throwing up, screaming in pain, at which point my son said to me, I'm phoning an ambulance, Mum. And the paramedics came, gave me morphine to help with the pain straight away, and said, look, I'm not happy to leave you to wait for an ambulance. He said, will you come in the car with me? Because they came in the paramedic car. And I was like, that's fine, just do what you need to. Halfway to the hospital, he had to stop in a lay-by to top up my morphine, and just sat there and, God, this looks well dodgy, doesn't it? I was like, yeah, it does. So when I got to the hospital, they checked me over and they said, yeah, you need to see somebody. And I had scans done, had blood tests done. And it turned out that I had a massive blood clot in my hepatic portal vein, my mesenteric blood vessels, which was caused me to have an ischemic bowel. So the reason I was throwing up was because my bowel had actually stopped working, and everything that should have gone through was actually coming back up. So for the first 48 hours, I went into organ failure. My liver was packed in, my kidneys stopped working properly. I was having problems breathing. My blood pressure kept tanking. So I ended up with drips here, there and everywhere, a morphine pump attached to me, a catheter in because I couldn't move. And they eventually put an NG tube down to siphon off everything that was in my stomach and to try and stop me from vomiting so violently. But the first 48 hours was very touch and go whether I was going to pull through it, because I obviously had a fever. They were pumping antibiotics into me, and liquids, fluids and things. And they genuinely didn't know whether I was going to pull through for those first 48 hours, which that's
Ali, I'm so sorry to hear that. I genuinely cannot begin to imagine. There were two moments in that story where it was evident that professionals were saying to you that there was a probability of not surviving this. When you went in the first time, the ambulance crews, I mean, what a horrible thing to hear, that they're trying to attend patients that are not surviving. And then you're one of those patients that's then on their way home despite being so unwell. And then again, all that time later, you're in a position where, very senior doctors are saying to you, you may not survive this. I can't even begin to imagine the impact that has. Are you comfortable discussing kind of the feelings around those two moments?
Yeah, it's fine.
That something you could share?
Yeah. At the time, I think I was so poorly. It's when I got taken into hospital. My primary concern was my son, because my son's disabled, and it was like, is he okay? Has he fed the dogs? Have the dogs got water? That sort of thing. Just the logical stuff, and things like having to cancel cake orders that I had to do and obligations I need to cancel. So that was the sort of getting everything done side of my brain was doing that. But I think everything was happening so quickly, and I was so poorly. I mean, the nurses were fantastic. At one point, I was too poorly to hold the phone. I literally had no energy, and they were phoning my mum and Ben, and so I could FaceTime them, and holding the phone up for me so I could actually speak to them. And there was somebody sat with me for the first 48 hours. There was always somebody with me or within our little area. So I was never on my own. And when I was at my worst, there was somebody with me constantly. So, which I really appreciate that, because at the time I wasn't really aware of it, other than I wasn't feeling well, and this needs to stop. Something's got to happen soon, that type of thing. It was afterwards, really, when I came home, I genuinely think I had PTSD, because for the first few weeks of being at home, I was very, very tearful. Slightest thing and I could cry. But on top of that, it was, I kept remembering little bits. Things like, I remember sitting here and sobbing, because all of a sudden I had this real strong image of two tiny little nurses. They were only little dinky things, dragging me up the bed because they needed to tip the bed for me. I don't even know why they had to tip the bed, but they had to tip the bed for some reason. And I'd already sort of slid to the bottom of the bed, and because I couldn't physically move myself, I had cannulas in both arms. I was attached to a morphine pump. They literally had to drag me up the bed, and it's little things like that. I had an issue with, because they were putting so much fluid into me, the cannulas kept blowing in my arms and my hands, and I started, my hands and arms swelled up, so they ended up putting what's it called? Is it a PICC line? Yeah, put a PICC line in for me so I could have my IV fluids through a PICC line. So it's I don't know how to explain it. The things that were happening then, they don't seem real. It happened, and I was a different person then. I was too poorly to actually take on board what was going on. I think it's as I've come out the other side of it, that I can appreciate how ill I was. And it's now that I'm at home, I just really feel like I'm in limbo. I feel like now that I've been released from the hospital, it's like, yeah, we've done our bit, off you go. And there doesn't seem to be any follow-up, or I'm having to chase to get things done. Because of my ischemic bowel, I'm living on milkshakes, Complan and Fortisips and bread, waffles, things like that, things that are easy to digest, which is really, really boring, and not a nice way to live. But I do feel like at the moment I'm living in limbo. I wish they could make a decision one way or another whether I need to have more surgery, have surgery done, or whether the actual clot is dissolving and everything's working. And so that's how I'm the state I'm at the moment.
It's very harrowing to hear your story, Ali. I genuinely can't begin to imagine how you went through those moments. And as you say, looking backwards, the retrospective perspective is really, really one way which can be quite frightening, I'm sure, for you and your family. And I really respect that. I just want to highlight, though, this timeline for you is a very long timeline, and with the nature and theme of this video series, we just so I'm clear, I'd like to maybe summarise for everyone. So around Easter time is the first diagnosis, and there was a week of having trouble at home. There was an admission to turning up at A&E with the help of the ambulance team, but then not actually getting admitted to hospital. And then how long was it before you noticed the serious lung problems?
Probably about a month. But initially I thought it was pneumonia. And I thought the reason I was struggling to breathe was because it was just the leftover bits from the pneumonia. So I would say about a month to 5 weeks. Before they then said, well, actually, let's try you with some inhalers, and that's sort of, I struggled on with that, but it was July 30th that I was admitted with the blood clot in my stomach, in my abdomen. So so from April to the end of July was how long that blood clot had been growing, which is why it was so big. They actually did say to me that you hardly ever get a blood clot in the hepatic portal vein because it's a big vein. It's a really big vein. It shouldn't get a blood clot in it, and they said it's very rare. But the reason it was so big is because it had been growing since I had the COVID initially at Easter.
Wow, and we are seeing in a number of patients, so I've read that problems with clotting can occur. And again, it's astonishing to think that we're talking many, many weeks, a couple of months, in fact, before you actually notice those symptoms. When you'd had the initial diagnosis at Easter, months later, you're then having problems with your clotting. You then have this clot in one of the most important blood vessels, and other clots in other areas are causing a reduced blood flow to one of the most important organs in the body, your bowel. And correct me if I'm wrong, but I think that's why you've been advised on the diet you have, and it's all that you can manage with the diet that you have, because
it is literally all
your bowel isn't working.
It's not. If I try to eat anything a little bit more substantial without being gross, it comes out the same way it went in. It's not being digested, and the pain that I have in the mornings before I go to the toilet is just horrendous. I can literally sit on the toilet and be in tears because it is so painful. And nobody wants to talk about bowels. It's a nasty thing to talk about, but it's something that we all have and we all have to deal with. And in my case, mine is not working, and it's not working because I had COVID.
Wow, that's a really key message, because I don't think many out there really understand this to be a serious condition for the bowel. In some cases, in your case in particular, it's very much labelled as a sort of a breathing problem. But indeed, not every patient responds differently. I frequently say this, and in your case, we have a really significant bowel concern. Maybe you could tell us, please, a little more about the follow-up that's planned and your concerns around the next steps in taking care of your bowel.
When I initially came out of hospital, I did have a follow-up appointment booked for the following week, but I was under Vascular while I was in the hospital, and they'd actually booked me into a surgical clinic So I ended up waiting 3 hours while they argued as to which department was actually going to look after me. At the end of it, the surgeon went, well, you still got a stuffed stomach, so we won't do anything yet. And that was it after 3 hours of waiting. I've seen the haematology department since then, who obviously are looking after the blood clotting side of things. And I'm on long-term blood thinners to try and break the clot down. He was lovely, very helpful, sorted out another scan for me so that they can see whether or not the apixaban, which is the blood thinner, is actually doing its job. The hope is that the apixaban will break down the clots enough that the blood will be restored to the bowel and it will just happily perk up and go back to being normal. That's the hope. The probably more realistic side of it is that I will probably have to have an operation, which would be either I think it's called an anastomosis, where they take out the dead parts of the bowel and stitch it back together. That's the good operation. The bad operation would be to have an ileostomy, because my bowel is not working. It might eventually heal itself, in which case the ileostomy could be reversed, or I could be stuck with that for forever, really. I'm not quite 50, and I really don't want to be in that position, and I never ever thought I would be in that position.
Just for those that don't know, so an ileostomy is a type of stoma. So you may have seen people refer to stoma bags. So essentially, one's bowel is on the outside of the body, and that, as you say, that's something that has huge ramifications for your health going forwards. Have they talked in more detail about that yet, or are they kind of not sure if you're heading that way? What's the current situation?
I feel very much in limbo, because nobody's making a decision yet, and it is a balancing act. I appreciate the fact it's a balancing act. They've got to leave enough time for the apixaban to work, to break the clots down and hopefully restore the blood flow. But in the meantime, whilst it's doing that, the bowel, more and more of the bowel is dying. So it's, where do you draw the line? Where do you say enough's enough? It's not working. We need to step in, or it is just a very up in the air situation. For my personal mental well-being, I wish they would make their mind up. I wish they'd give me a decision, because I don't know which way's up. You can't make plans. You can't. There's no way I could work at the moment, because I can't go too far from a toilet. The part of your brain, a part of the bowel that sort of gives you that early warning sign that says, "Oh, I need to go to the toilet soon," that's not working. So I literally get a 2-minute warning as you go, "Oh, need the loo now." I can't do a job where I'm either in front of a classroom full of kids, or I'm baking and literally have to run away to go to a toilet. It's life is very much up in the air because of it.
I think that's a really important message, because I'm very much aware that the majority of people haven't associated this, it's often mild breathing problems with the virus. They haven't associated this virus with long-term bowel issues. I don't think that's something that people are really aware of. Is that your experience?
Yeah. But what's odd is where my business is, it's an old school, and each classroom is a different business. So one of the other guys is a bit further down the corridor. He had COVID a couple of weeks before I did, and he and his wife both had it, but their daughter, who lived in the house with them, didn't have it. The wife had it mildly. He was quite poorly with it. And I bumped into him the other day. I'd gone in to check the post, and bumped into him, and he is having bowel problems as well. Yeah, he said he's having a lot of stomach cramps and chronic diarrhea. And so he's obviously got an issue with his bowel too. I know he's being investigated at the moment. He was having blood tests done last week, but that from my point of view, it was like, oh, it's not just me. It isn't just me. There are other people going through this too, and it's somebody I know. So it's because it seems to be affecting the blood vessels. Well, you've got blood vessels through every single part of your body, so it can affect anything. I keep having chest X-rays done in case I've got a pulmonary embolism because of the breathing being so bad.
Yeah, so there's a concern that the clot may not just be in the bowel's blood supply, but there's always a possibility, I'm sure there's always a fear as well, of having clots in other places. So as you say, a pulmonary embolism is where there is a clot in the blood supply to the lungs. Consequently, that can be catastrophic. Let's be very frank about this. Everything you're describing is potentially life-threatening.
Yeah.
And so even though you had those really terrible moments, I'm sure there's still that lingering thought as to how much you're going to recover and kind of how the future looks.
Yeah.
Is that fair to say?
Yeah, very true. I don't know what the future holds for me at the moment. I'm hoping that the drugs will do their job, and I will be, give me another 2 or 3 months, and I'll be back to doing Zumba classes or whatever. At the moment, I can just about get up the stairs without having to stop because I can't breathe. I can't walk very far because of my breathing, and also because of the pain in my abdomen. Movement is painful. It's uncomfortable. I look, in the mornings I look quite slim, but as the day goes on, I bloat out, and I can't wear clothes that are fitting me around the middle because it's too tight and it hurts. So I'm wearing big hippie dresses, which I don't mind. I'm a bit of an old hippie, but it's that sort of thing, where I've had to really change about how I'm doing things. I've always been a very active person, very, very independent, do it all on my own. I've got my own business, I've got dogs, I've got a disabled son. I've just got to get on with it. And it's very hard for me to ask for help. And I feel like I'm asking for help and nobody's giving it me. That's how I feel at the moment when I'm asking for confirmation from the hospitals, or please can I have somebody talk to me about my diet, and nothing's happening. And that's very frustrating, very, very frustrating.
Well, I think it's important to highlight, and we briefly discussed this before recording today, that many people are aware of, for example, angina, where there is a reduction in the blood supply to the heart muscle, and how excruciatingly painful and debilitating that can be for many patients. Similarly, they may be familiar with strokes or transient ischemic attacks, where the blood supply to the brain is potentially compromised. But for some reason, there just isn't the awareness around ischemic bowel. And I wanted to highlight your circumstances, again, to highlight just how much of a disability there can be around interruption to the blood supply to the bowel. And as a clinician, it's a condition that I take extremely seriously. And I'm absolutely, when I read your story, I was just astonished to hear of such horrendous complications of what many are perceiving to be a mild respiratory condition. And this really, really drums home the message that we really do need to take this seriously, whether we're clinical professionals or members of society, all of us together. I think that's really one of the messages that I wanted to share based on your story. I'd like to ask about the follow-up as well, because this feeling of limbo and uncertainty is one thing, but how do you feel about the recognition among clinical staff around the long-term concerns? Is there long-term provision?
No, I genuinely think they're winging it. They don't understand. Nobody knows enough about this illness, and nobody's bothered to track all the symptoms to put them all in one place and go, do you know what? People are suffering from breathing problems. There's people suffering from aches and pains. I mean, my knees are killing me most days, and that's not normal. I've got permanent cramp in my calves. And it's common for other people that have got long COVID, where they're saying the same thing, that we're you've got aches and pains that you never had before, old injuries sort of flaring up that haven't bothered you for years, and all of a sudden your back's killing you or whatever. But nobody's putting those various symptoms together and going, actually, do you know what? Let's look at the whole body. They're dealing with the individual conditions rather than looking at it as a whole. And I think that's the issue. And I think they're genuinely, how can I explain it? Either they don't want to know because it's too big a deal for them to get their head round, and it's just like, well, do you know what? We'll sleep back away from there, or they just don't know what to do. And I think it's probably a bit of both, if I'm honest. But I do think that medics need to be more aware of the fact that it's not just a respiratory illness, it's affecting so many other things. I mean, I'm very lucky. I know of somebody who has actually lost their hair because of it. I've still got mine, but it's silly things that it's knocking my brain. I'm a very well educated woman. I've got a PhD. I'm very busy. I've got a lot of things going on, and I literally cannot remember what I walked into a room for. I have to write lists everywhere so that I can remember to do things. I know that I said to you, please, you just message me, just remind me, because I have what they call COVID brain. I have got a brain fog. I literally can't remember. And it's silly things like just even trying to remember a word. I'm trying to explain something to somebody and the word will not come. I can see it in my head. I can even describe it, but I cannot think of what that word is. And that's so common amongst people that have had COVID as well. And again, it's something that nobody ever talks about.
Well, we haven't discussed that yet at all, but the neurological consequences, the consequences for the brain, more and more literature coming through on that. And I understand absolutely what you're saying about the awareness and the holistic care, because the way medicine is, as you know, as you've beautifully described, it's very much sort of subspecialties.
Yeah.
And then you end up sort of going between different subspecialties as a patient, and the patient journey can be quite disruptive in that sense. And I sort of feel that we do really need to join the dots on this one. In fairness to everyone internationally, researchers and clinicians, of course, as you rightly highlighted, this is something very new. It's everyone's response is somewhat different, and we are really learning as we go. But I hear you. I think a lot of that learning starts with a greater awareness, which I guess is why we're here today.
Yeah.
Yes, and I don't mind you saying that I was more than happy. The least I can do is to provide a reminder of the timings of our recording today. But I can't imagine for someone like yourself who has a very long history with teaching, as you say, PhD level education, is in a situation where the smallest things are something that need to be written down in order to be remembered.
Yeah. It's so frustrating, so frustrating.
Are there any particular things? Do you find there are some things more than others that are easy to remember?
No.
Is there a trend there? Can you sort of figure out a pattern?
No, it's literally, it can be remember to buy coffee, or it can be don't forget to phone the doctors because you need this, such and such a thing. It doesn't matter what it is. I can think it, and if I don't write it down there and then, I will have forgotten it. It's just, honestly, I've never been a forgetful person. I never ever. And because my life is so busy, I am so regimented. Everything is on a timetable, and I know exactly what I'm doing on any given moment. And I can't remember from 1 minute to the next. Honestly, it's crazy. And I've never been like that. I've never had that sort of like forgetfulness, and it is really frustrating. Very, very frustrating.
Well, Ali, I'm just genuinely blown away by how much has changed in a very short space of time. But I also admire how well you are managing and adjusting the best that you can. And despite the limbo, despite the fact that there are many different parts of your body involved in this, I just wanted to give you the opportunity to share any other messages based on your experience. Are there any other things that you would like those out there perhaps who don't take this seriously to consider?
I did everything by the book. I wore a mask. I washed my hands. I stayed indoors. I only went out for shopping, or to very quickly walk the dogs. I did everything by the book, and I still got it. And for all those people that say it's only the vulnerable people, I was fit and healthy. I might carry a little bit of weight. I openly admit that, but I was doing 3 or 4 Zumba classes and dance classes a week. I run a business. I was very, very active, and it literally knocked me on my backside. And my life has changed completely because of it. And it doesn't take 2 minutes to put a mask on or to sanitize your hands. But people are kicking up a fuss over it. Grow up. People are dying, and I've nearly died twice because of this. Not just once, twice. And I just think, I wish I'd kept a diary, because I think if somebody could have seen me as my family have seen me go through this from day one to now, they would think differently about not wearing masks, not observing social distancing. I genuinely think if they could actually, because you hear people say, oh, do you know anybody who's died of it? Well, because people are behind closed. I have to say, and I should have said it earlier actually, one of the hardest things with COVID was when I first got COVID and I was ill with it. My son's disabled, so we took the decision that we would stay away from each other. I lived downstairs, he lived upstairs. And he became nocturnal, so he was awake during the night, I was awake during the day, so we were never in the same place at the same time. That was a decision we took together. And everything I touched I disinfected, so I kept him safe. But it meant that I was on my own all day, every day. I couldn't really get upstairs. I was sleep on the sofa, and so I didn't have anybody to get me a drink or to help me to the loo or whatever. It was literally me and the dogs on my own. And I don't think I would have got through it had it not been for my mum, because she phoned me or FaceTimed me every single day, 4 or 5 times a day, just to talk to me to make sure I was all right. And so I could see a face the other end, because it's very isolating, because you have to self-isolate. It's very isolated. It's very lonely. It's a very lonely illness to have. And likewise, when I went into hospital, there's like 1,000,001 medics running around you, but all you really want is your mum or your son or somebody that who's going to be there with you. And of course they can't come in. So that, I think, for those of you that are still not taking it seriously, keep that in mind, because if it was happening to you, you wouldn't want to be on your own, and that's what you have to go through with this.
Ali, I think that's a very, very compelling message. I completely understand that. And I think you've highlighted there the lack of visibility of those who are going through the most horrid time with COVID-19. And you've also highlighted as well, this doesn't just impact on one individual within the family. It impacts the entire family. It impacts on your business. It impacts on the school environment where I know you teach part-time. And I just think that again, you've got to take this seriously. We all have a responsibility to take this seriously, because it doesn't just affect us, it affects everyone around us. Ali, I'm very, very grateful for you having the courage and honesty and to come and share your story so candidly with us today. Thank you so very much. And most importantly, I wish you very, very well for the future. I hope your recovery can continue. I think hope you can come out of this limbo, and I'd be more than glad to keep in touch.
Thank you. I just hope that people will listen to our stories. I know I'm one of many, but we're all sort of saying the same sort of thing. And I'm so grateful that you are collating all these stories so that people can actually see that we are real people. It's not a government statistic. We are genuinely real people going through this. So thank you so much. I automatically said yes, please, when you asked for volunteers, because I just think it's so important that this message gets out there.